wellbeing strategic aims and engagement. So the Reading Integration Board are actually leading on the development of the health and wellbeing strategy priorities for Reading for priorities 1 and 2. So priority 1 is reducing the differences in health between different groups of people. Priority 2 is supporting individuals at high risk of negative outcomes to live healthy lives. And we've heard about the strategy earlier on from the presentations. And we're working with the leads for the other priority action plans as well, where there is crossover, for instance, with for people with low-level mental health problems, such as anxiety and depression, to ensure the approaches that we take will enable services to wrap around individuals based on their need, linking the integration agenda and the aims of the Better Care Fund. We are looking to get service user views and input to developing those action plans. We're really keen to work with representatives from service user forums. And, you know, as Becky mentioned earlier, that's a key area really for our focus. We really do want to involve people at this stage of developing those action plans. And we're engaging with the voluntary care sector representatives through our VCS forum, which is aligned with the Integration Board programme plan and our health and social inequalities focused work. So I think that's pretty much covered the bulk of the report, and I'm happy to take any questions from anybody. Thank you very much, Councillor Hoskin.
Thank you, Beth, for a very comprehensive run through of that. Quite a mixed picture in lots of ways. I think it's quite difficult sometimes to disengage the impact of such an unusual last 18 months, the non-elective admissions piece. Maybe one thing we can look at is how far we're, how far that compares to what's happening elsewhere, because it does make sense. It makes sense you have lower non-elective admissions when people were keeping away from their doctors, but actually that may have really bad health impacts and lead to higher, rates later on when they realise they should have gone to their doctors before. So I think that's important. Right, okay, I've got Councillor John Ennis has indicated. John.
Yeah, sorry I've got to move away a bit. I do apologise. Don't realise how close you are to the screen. Yeah, thanks for that. It's an interesting report at a very challenging time, and I'll just ask a question about some of the figures about reablement. Need to get the figures up more in the discharging. Is how do you think we could do more work together as partners with health and adult social care within I'm talking about Reading as lead council for social care, how we can work more closely together to try and integrate our interests, because sometimes it feels the interests are a bit different operationally, with hospital, and they're all legitimate as well. Legitimate interests, how we can maybe link together more to get better outcomes for residents. I don't know what your view on that is.
I think that's you're very welcome. It's a very good point, actually, and I think this is an area that we can definitely improve on in terms of engagement and understanding the operational view, and how that impacts, at the front end of services. And we're working really hard, actually, to engage people in their views and in the development of these services. So, as I said, there is a review currently ongoing of the community reablement team service offer. And we would be keen, actually, to hear from people who have, views about how these services are being delivered at the front end. So please do get in touch with me, and I can connect you with the people that are undertaking that review.
Great, thank you, and thanks, John, for that. That's a good question. Right, I'm not seeing anyone indicating. Thank you very much. Obviously, a lot of really important work going on there. Thank you very much for bringing the reports, Bev.
Thank you.
Thank you. In which case, we go on to the last item, which is our dashboard. I've got Kim and
yes,
Becky.
Kim's not with us. I'm presenting, if that's okay, Chair.
Okay, I don't know if Tom knows he's suddenly come up on the screen. Yeah, he's gone. Oh, well. Anyway, Becky, go ahead.
Right, thank you. And I've just asked Nikki to put the overall chart, the performance chart for Q3 up. It's a bit difficult to see, but hopefully you've all had it sent round, but I just thought it was useful to have. So the purpose of the report is to give an update on where we are with the health and wellbeing performance measures that were set to measure progress against the existing health and wellbeing strategy. And the report sets out that we have now included 4 additional areas around dementia, health checks, alcohol and suicide rates. So I think that's good in the way that, you know, we're being flexible to make sure we're measuring what's relevant to the work we're doing in the strategy. And the second aim of the paper is really just to note that this dashboard will be reviewed and revised in light of now we've agreed the new health and wellbeing strategy to find measures that's going to look to see how well we're delivering against the next 10-year strategy. And for me, those new measures, we must make sure they're timely, they're specific, they're sensitive to what we're trying to do and realistic. But just to summarise, I think where we're at Q3, I think you'll see from the reds there, those are the areas where we're not making progress. We haven't achieved our targets. And you can see with the amber on the right-hand side that many of those are stubbornly not moving. So, you know, we've still got lots of challenges ahead. But if I just summarise the ones that we're still from this period not achieving, it's the childhood obesity, overweight and obese, smoking in routine and manual groups. And I think that's, you know, obviously linking back to Chris's presentation, really pleased that we will be targeting that new service at these groups. Health checks remains a significant challenge, not surprising with COVID. I think general practice has been under such pressure, but we really need to make sure now that we're addressing that. We have got additional funding into the system to increase health checks. So some work's going on now about how we enhance and develop our local health checks programme. Social contacts for carers still remains an issue. Children's mental well-being, and again, you know, it's good that that's very much reflected in our new strategy. So we need to, you know, make sure that we're driving improvements around that. Alcohol treatments, completions of successful alcohol treatment is still an issue. And, you know, some anecdotal advice, and I'm trying to find out what's going on in terms where we're hearing that services are coming under more pressure, whether that's a result of COVID or economic situations, but that's still an issue. And then finally, dementia diagnosis, which is so crucial in terms of identifying people early to provide support and help. So that's just a sort of overview of where our challenges are to date. There have been some good, there have been positive improvements, and, you know, we should applaud that the successes we have been making, but there is still quite a worrying number that are not being met, and there's no real significant change. But I suppose the point just to leave then is, going forward, we need to review these, review the new 5 priorities of the strategy, and make sure we pick really effective measures going forward. So I'll stop there and answer any questions or comments anyone has.
Thank you, Becky, and I think that's absolutely right, what you're saying there. Any questions, any points anyone wants to raise? No, so it's really, you know, a lot of work for us to do. I suppose, you know, you've got the England average. I suppose you know, it's not, viral pandemics are not good for public health in lots of different reasons, aren't they, that we can see, and you can sort of see some of that on here. But it's also, you know, a lot of the challenging areas that we know, and not much of that's not really much of a surprise, does fit against the health and wellbeing strategy. So obviously developing the really, you know, really effective implementation plans is going to be so important for us in the coming months and over the years. I haven't got anyone else indicating, so thank you very much. I always find, you know, those statistics fascinating, if not always as heartwarming as you might want. But thank you for presenting that. I haven't got anyone else indicating, so we are done. It has been a long meeting. Thank you everyone who's managed to get through to the end. Oh, the last item, which Nikki always tells me we do have, is the date of the next meeting, which is the 21st of January of next year. So thank you everybody, and have a great weekend. And
Cheers, Graham.
Thank you
very much. Bye.
Thanks, Graham.
Thank
Bye.
you.
Thank you.